With each coronavirus case update, the numbers of those recovering grows. 437 people infected in the valley fall under that category. But what exactly does that mean? Channel 5's Rudy Meireles has a closer look at the numbers of the potential long-term challenges fighting the virus.
Officials around the area have been using one word to signify something positive from the rising COVID-19 cases: recovered. Around 51% of cases in the valley have recovered from the virus, but many are confused as to what it means. Dr. Jose Villalobos has seen several of the area's COVID-19 patients at Harlingen Medical Center. He explains the primary goal is to get patients off of oxygen support.
When they're recovered, they can just be breathing the oxygen that in the ambient air, or if they just need a little bit of oxygen to where oxygen companies can dispense tanks at home or concentrators at home, then we'll arrange that for them.
Helping patients breathe again isn't the only problem. Long-term stays pose a secondary issue for some like the elderly.
Just because of the decreased muscle mass that they have, staying in the hospital for so many weeks will make them very weak and debilitated, just as a general rule with any other disease process.
To be cleared, patients must test negative twice per CDC guidelines. Dr. Villalobos says testing issues have kept some patients in bed longer than needed, compounding the issue.
It depends on the volume that's being asked of them to process these tests. We've had results come back in as quick as 48 hours, and some be delayed as much as 7 days.
While physical therapy can be performed, other complications could grow serious.
There seems to be something with the COVID virus that starts affecting our hematologic system, our blood system, and it makes us more prone to forming clots. And that in itself is another disease process.
He says some confuse the word recover with clear to go on as normal, but future complications could arise.
And just in general, any insult to the body, any virus infection that you have, any pneumonia that you have, causes inflammation, and eventually inflammation, when it subsides, causes scarring. People forget that, right? So a cumulative effect of scarring through all of the infections you've had in your life.
He says those that think the high recovery number means the virus isn't serious need to understand the clinical definition.
Recovered just means you're good enough to go home. You don't need to be in a acute care hospital when you're considered recovered. It just means you don't need the equipment, the medical attention that we can offer here in the hospital. By no means does it mean that you're back to normal.
Dr. Villalobos added that the low number of patients in Valley hospitals is a sign social distancing recommendations work. With asymptomatic individuals, everyone needs to practice safety to keep cases and complications from growing. In Brownsville, Rudy Meireles, Channel 5 News at 10.